Hello, good afternoon. This is the Health, Aging, and Disabilities Committee meeting, virtual meeting with anchor location in person and remote participation. I am Vincent White, council member for the 1st District. At this time, I'm going to turn the meeting over to the chair, Councilwoman Fields.
Thank you, Councilman Vince, I'm sorry. Excuse me, let me start this over. Thank you, Councilman Vincent White. I really appreciate you standing in for me. This meeting is now called to order. This is the Health, Aging, and Disability Committee meeting for February 28th, 2024. I am the chair, Councilmember Brigida Fields for the 5th District. At this time, I will call the roll for those members of the committee first. Councilwoman Maria Cabrera.
Present.
Councilwoman Yolanda McCoy.
Here.
Councilman Albert Mills. Councilwoman Xanthia Oliver. Councilman Vincent White.
Present, Madam Chair.
City Council President Ernest Congo. As a friendly reminder, only members of the committee should be making motions and seconding. Okay, and with that being said, we can start with the presentation.
Thank you. My name is Sarah Trenhauser. I am the CEO of Marikey Total Health, and I have with me my colleague.
My name is Georgette Dukes McAllister, and I'm the Executive Director for Marikey Total Health.
Welcome.
We will be joined by our colleague Lillian Schoenwolf, who is representing St. Francis Hospital. You all have received, I believe, a presentation deck. Until Lil is able to join us, I am going to start a little bit into the presentation and talk to you a little bit about Marikey Total Health. So if you are following along those slides, it'll be slide 8. So to introduce ourselves, Marikey and Marikey Total Health are nonprofit organizations that are focused on providing health and human services. Marikey operates in 12 states, including Delaware, providing homes for individuals with intellectual and developmental disabilities, mental health care, substance abuse care, as well as services and supports with children with autism and also emotional disturbances. Marikey and St. Francis Trinity Health Mid-Atlantic have a history of partnership as we're focused on a similar mission of improving access to care for vulnerable populations. We have partnerships throughout the region, including Delaware, and when St. Francis let us know that they were interested in pursuing a healthy village at the St. Francis location, we were interested in becoming a partner with them. And Lil will tell you a little bit more about the healthy village concept, but really our goal is to be able to provide physical, social, and behavioral health care for the individuals we serve through a variety of programs and supports. One of those programs is Marikey Total Health, who Georgette and I represent. Marikey Total Health is an independent affiliate of Marikey, the larger corporation, and we're focused on providing primary care for populations with complex support needs. So for an individual that might have a serious mental illness or an intellectual and developmental disability, it's difficult for them to access primary care. And I think we all know that your physical health care can have a huge impact on your mental health and vice versa. So what we've seen with many of the populations that Marikey serves is that for someone with a serious mental illness, their life expectancy is 30 years less than the general population, and most of that is due to complicating physical health care factors. So Marikey Total Health was really started with addressing that by providing a patient-centered care experience. And what we've been working with, if you look at slide 9, what we've been working with is becoming a tenant at St. Francis to provide care and supports for the population that is being served. One of the ways Marikey is doing that is through a wellness recovery team that is operating in tandem with the St. Francis emergency room. That team consists of a nurse, a behavioral health therapist, and a peer support specialist, that if there's someone who comes into the St. Francis emergency room with a mental illness, they're able to be seen by that wellness recovery team that can help get them into community treatment with the goal of keeping them out of the hospital. Marikey is also exploring some other opportunities to bring additional substance use services into the hospital at St. Francis. And Marikey Total Health is looking at how we can provide physical health care to the population that will be coming through the St. Francis Healthy Village. And one of the ways we are looking at doing that is by partnering with the existing family care program there to provide those primary care services with the hopes of becoming a federally qualified health center. And the reason we've been exploring that as the option within the Healthy Village is that it lets us provide additional services and supports to the population being served. And I'm going to actually turn things over to Georgette to talk a little bit about federally qualified health centers and FQHCs.
Thank you, Sarah. FQHCs, I've been in the FQHC environment now for about the past 30 years, and the model really works. It is designed to have the patient in the center of their care and make sure that they get access to physical health care, mental health care, any case care coordination services, as well as dental services. We are primed to serve the entire patient, and we also serve the entire family and provide necessary services that are also outside of us as far as referring specialty care to providers and making sure they have access. The majority of our patients we serve are Medicaid and Medicare. We also serve a large portion of uninsured patients with a sliding fee mechanism where they can pay a nominal fee. The thing that, with the nominal fee, we also encourage those patients that do not have insurance to apply for insurance. Many times they qualify for the Medicaid program, or they can go out to the marketplace and get insurance as well. The other factor about FQHCs and the sliding fee scale is we know that there are a lot of people that are classified as working poor that may have health insurance through their job. A lot of those people have high premiums, high deductibles, and even if they qualify for sliding fees at our locations, they can get discounts on their services as well. It's a very unique system, and this is a model that has worked across the country. We also make sure that we don't compete with other providers of care, but we complement each other and make sure that we're working to serve all the patients that need access.
I think the other piece that we would just want to note is Wilmington has two great existing FQHCs, Henrietta Johnson and Westside. We have had conversations with both of those entities to talk to them about our plans. As Lil will tell you momentarily, when she talks a little bit about the needs and why St. Francis is thinking about a healthy village, we also know that that this area immediately surrounding St. Francis Hospital is a medically underserved area, and that there's still a large population that isn't receiving those primary care services that they may need. So I think with that, I will turn things over to Lil, and then we can circle back around. So if you're following along in your slides, that would be slide 2.
Thank you, Sarah. I apologize for being late. Thank you. So just to give an update, so St. Francis did start this Healthy Village project about 2 years ago, and we had decided to, we spent a good 6 months just interviewing folks, both door knocking on the neighbors around the building, around the hospital, as well as local legislators up to the governor level, as well as board members and others who have been a part of St. Francis for many years. So we wanted to make sure what they thought about our plans. We want St. Francis to be a healthy village. St. Francis already provides the community with all the health care that they need, but our concerns were what's really affecting the neighbors in that area or the community in that area to receive the best care, not just health care, but also deal with many of the social influencers that affect the way that they can live healthier lives. And so as we started to talk to folks, there were 4 main areas of concern. Behavioral health, obviously, with substance use abuse services needed, education, job training, workforce development, affordable housing, senior services, and then health equity as a whole. And so at that point, we decided we were going to move forward with transforming the hospital from a 400-bed hospital and continue the services, all the acute services, emergency services, surgery, all of that will continue, but at a smaller scale. So instead of 400 beds that we presently have, we probably only see a census of maybe 70 a day. And so what can we do with the underutilized space? And that's when we decided we'd take part of the hospital and continue to do the beds for those services, but the other areas of the hospital, why not form this healthy village by collaborating with other social services agencies and organizations that can really help the community members to receive the care that they need, specifically around those needs. What often happens is we provide great health care, and then at the end of their time of discharge is when a whole lot of other issues come up that affect the way that they live. And so we say, you know, what are some of the issues that you're dealing with at home? It could be food insecurity, it could be violence, it could be housing. And we don't know what happens to those individuals once they leave the hospital. We are able to give them services and resources, but then what oftentimes happens is they come back and get readmitted because they don't know how to get those services. Or they come into the emergency room because they don't have a primary care physician, and they don't necessarily need clinical help, but sometimes needs the behavioral health and mental health services. And so that's when we started to work along and start to really focus on the community organizations, social service organizations right there in Wilmington, not necessarily to say we want you to leave the community, we want you to stay there, but what we would like for our community partners is also to be in the building. And so the idea is the lobby area is getting reconstructed in the next few months. We did receive $1 million from Highmark to build what we're calling a main street. So the Healthy Village project is kind of 3 different areas. One meaning the acute services, the clinical services, one area where some partners will take up full units of areas, and we could show you what that is further along. And then the main street would be kind of walk in, the idea is walk into the lobby, be greeted by a community health worker, find out what are the needs of that individual, and then have individual offices. So for instance, you can have the Latin American Community Center who may have 1 or 2 offices there to be able to connect their resources to folks that come in, as well as being able to provide those bilingual services. So that's a great example.
Just say next slide. If
Oh, next slide, sorry.
Diana's controlling it.
Sorry. So these are three of the partners that are already in the building to show you a little bit of an example of what we're doing. So hospice is now taking up a full unit. They're also looking to, they're looking to add on additional space in the building for a dementia unit. And then through Senator Brown's Hope Commission, we have Women's Reentry Program. That's an example of a smaller, not a full unit need, but they have a couple offices there where their participants are able to come to the hospital, receive the services that they provide, but they, at the same time, be able to get the services of other partners. And then with Marquee, we have the wellness recovery. And so that about 18 months ago, we did receive $2.5 million from DHSS for behavioral health services, which we partnered with Marquee. And that is a team that's in the emergency room right now that is a case manager, peer support person, and an RN, correct. So with those three individuals, they're able to connect their services. And then at the same time, they'll also be located in another part of the hospital. Next slide. One of the other areas of need was housing, and we were very fortunate through Trinity Health corporate office. They provided us a $1 million grant opportunity for what's called Transforming Community Initiatives. So this is not $1 million that we receive, but rather we connect and collaborate with a partner in the community for a specific need, and ours was housing. And so we collaborated with Westside Grows, been very involved with their revitalization plan. And right now with that grant is focusing on are two things. One is the funds will initiate focus on expanding homeowner repairs, which is going on right now, continue to support the development of affordable housing, also look at new ownership opportunities, and then continue to advocate for the programs. What on the other side of it, if you look at the picture, we right now have a two-story garage across the street from the hospital that is underutilized. And so what we've done is we are giving air rights to Westside. They are going for their funding right now. What we're going to do is 57 one-room apartments for seniors. And then our part in that would be obviously in supporting their any types of services that they need, not only in healthcare, but also in other areas, and that's where the FQHC would come into play. Next slide. This is an example. We talked about the $1 million donation from Highmark, and so that construction is going on right now. This gives you an idea of what the hospital, what I believe the architects and builders will start to change, especially the first floor of the hospital, to allow some of these different organizations to come in. What we are right now opening in the old gift shop, we've turned that into a community health center. This will specifically help to address health equity needs. And so right now we have what's called a CARES. It's Community Aid Refurbished Equipment Store. That's where we take in gently used durable medical equipment and we give it out for free. Oftentimes with Medicaid and Medicare, you might get a walker, but you won't get a wheelchair, or you might get one form of toiletry, but not a second. And so this allows folks to be able to get all the needs that they have. Surplus food, that is a program that any food that's left over from the cafeteria that day is packed up and ready to give out to those that are homeless, as well as, unfortunately, some colleagues who are also going through food insecurity. And then we have emergency food, and we also have packets of emergency food for homeless individuals that visit the emergency room. As well, in that center are personal hygiene products, and along with that is our Tiny Steps for maternal care, where we are giving out car seats, formula, cribettes, diapers, anything that you would need in that. And so that's pretty much ready to open. And next slide. So the strategy for 2024 is to continue to work with these community-based organizations. We'd like to now go back, and those that showed interest in coming into the building, we want to secure who actually is still interested. We want to make sure that we are still targeting those 4 areas of need, looking at other Delaware partners, specifically for SUD services and behavioral health, to work along with the services of the FQHC. We are also, Nemours and NovaCare are also interested in additional space there, so we're also looking at, is there organizations for child care services and any type of trainings for families in that health equity center. Along with that, we are also looking at what is the education and workforce development part of this project look like. So we don't want to necessarily say we're going to have this college or that university come in. What we want to do is make sure that we're targeting the children in that community that are younger, be able to provide mentorship programs right there, and also for those individuals, there's a high number of homeless 18-year-olds that they're aged out of foster care. And so how can we help them to make sure that they are receiving their high school diploma, as well as you might be able to, at the same time, be able to get a certificate program for a CNA or culinary studies or any of those type of programs that we could do at the same time. And then obviously we talked about the programs under the Health Equity Center. And right now, the most important part is funding. Trying to get more community health workers and our advocacy team working very hard in making sure that we're getting the message out, as well as the needs for additional funds. Next slide. This is a busy slide, but it shows you all the local organizations that we are presently in conversations with, and as you can see, it's divided into those all those areas of need from the beginning of the concerns of the community. And so those that are darker are the ones that are already in the building or already have started. And now we're just going back again to those individuals to say, okay, where is it that we play best? The whole idea also is to make sure that as these partners come in, that they learn to work together. And so data sharing and all of those ways of making sure mission is being accomplished, making sure that everyone is working for the same community, that'll start to take place as we go further. And next slide. I think that might be it. Or, yeah, that might be it. So that's what's going on at St. Francis. We're very excited, and we did just actually report to Trinity Health corporate team, and they were very pleased with realizing the challenges that we're facing, realizing that this is a new concept, but we truly believe that this is the future of healthcare.
Councilwoman Bracy has her hand up, if you can just mention it too.
Yes, Councilwoman Bracy.
Thank you so much for this presentation. I just had one quick question. If well, actually, I guess 2 parts. One, are you still looking for partners? And if so, like, for example, I know you mentioned behavioral health. Are you still looking for agencies that are interested in being a partner? I saw your slide that had the list of folks that you're already speaking with, but I wanted to double check if you were still open to additional partners, and if so, how would those agencies get in contact with you?
We are absolutely still looking for partners, and this is one of those projects that's not going to end. This will continue to change, and as the needs in the community change, so will the partner needs change. We have plenty of space, and they certainly can contact me. I think if my cell phone is not available, I could certainly give you the link. Yeah, but I'll share that, and please, anybody that you refer, we'll be happy to speak to.
Thank you, Madam Chair.
You're welcome. Councilwoman Cabrera.
Yes, thank you. I loved your presentation. This is so like something that everyone should be doing. It's just too much common sense. You know, it just really makes sense to do this. So one of my questions is in terms of the food is I know that, you know, we go to events, restaurants, just things, caterers, and a lot of times they tell you, you know, we got to get rid of this food. We can't keep it. So my question is, would you accept food donations from external sources, or do they have to come from the internal source for quality control, etc.? I know some people used to say, well, we'll get sued, that's why we don't donate the food anymore. But that's not true. There's so many people eating out of trash cans
Oh,
right now
yeah.
that the fact that you can get them food, and some of this food is really good quality food,
Right.
I just don't see how that should be an issue. But how do you handle that? Is that something you would accept?
I think it's something we would definitely want to talk about. Right now, we are working with Food Bank to see how they can come into that Health Equity Center. But I love that idea with restaurants. It's actually how the surplus food program started at the hospital. You know, all the food at the end of the day doesn't make sense. What do you do with it? And it's been really successful. In 1 month, I think we fed 236 individuals. So I would love that idea. I'd love to connect and you know, have that further discussion on that.
That's great. That's amazing. I had another question, but I swear to God, it must be my age. I have a birthday coming up. It's hitting me real hard. As soon as I thought of the question, I went to my notes so I could write them down. I couldn't forget them, and it flew out of my mind that quickly. If it comes back to me before you leave, I'll ask it, and if it comes back to me, I'll just go ahead and send it to you.
Yeah.
But thank you so much for everything that you're doing. I know there was a time where the hospital almost closed down, and I said, I can't see how this could happen with St. Francis. You guys are such a community hospital. Like, so many people go there, and what would we do for healthcare if you weren't there? So I love to see this out of the box thinking and progressive thinking to help all members of our community. Thank you so much.
Oh, yes, thank you for the support. I think one of the messages that we're trying to be very careful is to make sure that people realize we're not closing. In the beginning of this project, people heard Healthy Village thinking that it was closing the hospital, and that's not what's happening. It's actually an opportunity to take care of that whole person.
Amen. Thank you.
Councilwoman, thank you, Councilwoman Cabrera. Councilwoman McCoy.
Thank you, Madam Chair. This is very exciting. As a person who has used the hospital for numerous years, it is truly a community hospital. I have been a patient at Tiny Steps. I have, like, when it was first starting up, I've worked at Westside Health and Cornerstone West. So I've saw this design that you have, that you've presented before us when it comes to the rooms atop of the parking garage is beyond anything I could have imagined when Mr. Calistro had talked about it initially. I think that it's great. I am curious though, because right now it seems that you're in I guess you're in the fundraising portion of things. Is this something that you feel like you can actually put a date on that you could probably get started, or are we still just fundraising?
Actually, we started. We already have the Healthy Village started because we already have 3 partners in there utilizing space. With Nemours is there, Hospice is there, Women's Reentry is there, and Marikey is there. So yeah, we've started and we'll continue. Funding will always be priority, but yep, we're up and going.
I'm sorry, may I follow, Madam Chair?
Oh,
Yes, you may.
Okay, thank you. So I do realize that when it comes to the Trinity Health, that I know that all those partners are actually within. I was actually a little bit more specific when it came to the building of the senior apartments. I was just trying to get a little bit more information about that. I've actually just was there and witnessed the ribbon cutting of the hold on, what was the Hope Commission for Women there, and I'm like, it was such a phenomenal thing. But when I seen that design for those apartments, I was like, whoa, And so that's the one that I was actually asking about. You've already started that, or are you talking about your partnerships with your other extended, like those other agencies?
I'm sorry, yeah, I misunderstood that the agencies within inside the hospital has started the housing project with Cornerstone. We've identified the developers, and Paul has already started to receive the approvals for funding in different areas and continuing to do that. We're also right now, what we needs to happen in the next few months is the zoning. And so once we get the zoning passed, they'll start the project. But it'll take time to get through all the legal parts.
Yes, I can imagine. Thank you so much for answering the question.
Thank you, Councilwoman McCoy. Does anyone else have any questions for our presentation?
Madam Chair,
Yes,
Councilman
sir.
White, I have some questions, if I may.
Yes, you may, Councilman White.
Thank you for the presentation. A couple of items. You mentioned that that this model, or you don't see yourself competing with other providers. Why is that?
Because there's such a great need out here now. A lot of the other providers have there are still unmet needs of the population that's being served. There are extreme wait times to get in to see these providers, and this is just another avenue for us to serve the population that is definitely in need of the services.
So can you expand on those metrics in terms of the population that's not being served? I read something about that according to this presentation in Wilmington, 22% of the population
Yeah.
for AF.
Yes.
Can you expand on that?
Those scores that you see listed in the program, and that would be for reference slide number 10. So those are based. The federal government classifies different zip code unmet need scores for zip codes across the country. We know that the zip codes surrounding the St. Francis Hospital have a high unmet need score. And we also looked at, because we know there's 2 existing health centers in the area, we also looked at what % of the population is actually being served by health cares, and how does that by health centers, and how does that compare to how the low income and vulnerable population is being served in other cities that might be comparable. So we looked at Wilmington. We know that 22% of the low income population is currently being served by an FQHC that is currently existing, and 9% of the total population is being served by those FQHCs. When we look at other cities—
Why do you think that's so?
I think that there is a need for expanded access to care. I think that there is probably, as Georgette mentioned, there's difficulty getting in for access to care. There's also education about what health centers can provide. And I think there is an existing patient population at St. Francis that we know is in need of care and services, a high Medicaid population that's already coming into the health center that may not be receiving care. We also know from the Marquis perspective, when people have a disability, have a mental health issue, have a substance abuse issue, they're less likely to seek primary care and address those physical health care needs that they have. So our goal with this health center and being able to address the whole person care needs, our hope is that when we're addressing the whole person, we're taking care of their social support needs, their mental health needs are under control, they are in recovery, that they will be able to address then those physical health care needs as well.
Madam Chair, I just have a few more questions, if I may.
Yes, you may.
So this transformation of the hospital obviously has an impact upon the community. So has that been taken into account until, and if so, how has the community been made aware of this additional uses?
Yeah, we've had several community meetings, so we're pretty much out in the community weekly, every other week, just making sure to answer questions. And then along with Paul Calistro and his community meetings regarding the housing part, we also go with him to make sure that people understand his part and how it reflects and how it coordinates with the Healthy Village inside the hospital.
And you reducing the number of beds from 400 to 70 approximately.
We're probably thinking
that-
about 100 to 150.
And that's based on,
For
Occupancy.
probably the past 5 years that I know of, data-wise, we have not gone over a census of 70 other than during COVID days.
lastly, you mentioned in the strategies, developing outcomes. Where are you guys at in that process? Outcomes and goals? Outcomes and measures, where are you at in that process?
Just starting. So strategy for the hospital we have set up. What we're trying to figure out is what do we want to see 3 to 5, 10 years from now along with the partners. So what we'd love to see is a reduction in readmissions to the emergency room. What we'd love to see also is once we connect an individual to some of those other resources, how does that individual's family or their self-life improve? And so that'll be kind of just targeting, following that patient as they go through the food bank, go through the educational partners, go through housing, follow children who start at that middle school age and following them through. There's a couple different ideas that we're kind of throwing around right now. What we're doing is working along with the partners to decide what should be the measurements and outcomes. But for the hospital itself, it would definitely be, how do we make sure we're doing a healthier community in the sense of overburdening the emergency room with admissions that really don't need to be seen there. Might be that some of those individuals just have to be going to the FQHC or just going to get behavioral health.
And lastly, Madam Chair, if I may, the community, those zip codes are, as you've already mentioned, are very diverse. Mm-hmm. Different languages, ethnicity, et cetera. So what makes your how are you going to communicate this healthy village in a non-traditional or traditional manner on an ongoing basis that's going to drive either foot traffic and or vehicle traffic to this healthy village? And what's the strategy to get that person at 5th and West to walk up the hill, or 3rd and Clayton?
It's a couple different, because that's one of the reasons we don't want partners to leave the community that they're already serving and that people go to. So building, still connecting and having those partnerships, which we have right now, and that obviously brings patients in. So continuing those relationships, as well as those partners are also in the building and their participants come in to use their sources, then we also connect. We think that another major part is going to be community health workers. Just like Marikey, for their wellness recovery teams, we realized pretty early on that their work that they're doing in the emergency room makes sense because they're addressing those patients right away. But because of the high amount of homeless individuals that come there and need those services, they also needed a team outside. And so now that's what they're targeting, is going to various spots where we know, Sunday breakfast, for instance, all those areas that we know that those individuals are at. Another part that we're looking at is we had the St. Clair Mobile Health Services van. We're now looking to, we stopped the services for a short while to decide how we're going forward with it, because we believe that along, again, with the services the FQHC through Marikey will serve, we'll be able to have Marikey be out in the streets on that van to be able to provide not only the primary care needs, but also to be able to connect them to their other resources.
Yeah, and also in addition, the health center, we will have access to video translation services for the population that we serve. We will have bilingual staff. And the great thing about FQHC is we hire from the community. So we'll give the opportunity to the residents in the community and our patients to apply for some of these positions. and be, effective in our health center as well.
Thank
And
you.
I think that's the other plus too, with the FQHC working along with our already existing family practice and our already existing GME or resident program. That's an easier sell right there. You already have those patients and those committee members that are coming here.
Well, it's an ambitious project, and I wish you guys well. Madam Chair, I don't have any further questions at this time.
Yes, Councilman White?
No, Madam Chair, I was saying thanks for your patience. I don't have any further questions at this time.
Okay, thank you. Councilwoman McCoy?
Thank you. You know what? I think that Councilman White actually ended up getting my question answered. I would like to make a comment, a statement though, because I was very surprised that they're just starting to do data collection at this moment, because from its West Side Girls' inception, healthcare was definitely one of the pillars that they wanted to focus on, and that's been more than 10 years, and I'm just really surprised that this, and now they've already done their first series of like a surveys had happened more than 10 years ago, and now they've already done a second, and I'm just surprised that we're actually looking at the data when it deals with healthcare and trying to create a campus of some sort in the Hilltop portion of Wilmington. I'm just surprised that we're just starting to collect data at this moment. So that was my
Yeah, and I would clarify just one thing. Trinity Health as a whole, we collect data constantly. We have the community health needs assessment that's done every 3 years. But as far as Trinity Health, we have a whole database system that we have 92 hospitals take advantage of, and that tells us everything and anything to do with the zip codes that we provide services for. What we need to do is to focus on what are the measurements and outcomes that we want to see from this project to prove that the Healthy Village, a whole, having those services within a hospital is what's going to change healthcare in the future.
And I believe that's also going to be a focus, looking at Healthy People 2030 at this point, to benchmark those measurements.
Thank you. That was the only comment that I had. Thank you for allowing me that question, Madam Chair.
Well, I just want to say thank you for all of us for allowing us to give you an update, and appreciate any questions or any connections, anyone that you think we should talk to, please, just share our information. We'll be happy to speak to them.
Thank you for your time. We appreciate you.
Thank you.
Is there anyone in the public that have any questions?
No, I'm here to support them.
Okay. This is coming from me, ladies. I just want to let you all know I really appreciate the presentation. It was great information that you shared with the community. And, we as community leaders, we're not just council people, we are community leaders. So it benefits us and you all for us to make sure that this information is put out into the public so people will know what resources they may have. I was really excited to, hear the part about the mental health. My question to you is, say if there is we'll say a connections patient that's having an outburst, and they call, and the residential aide calls the police. Do you have someone, and maybe I missed it, but do you have someone working with the police with these types of calls? Or do you just suggest that the police officers bring these individuals into the facility?
We'll say from the Marquee side, we are not currently working with the police and 911 services. Marquee does have programs in other states where our team partners with police officers, with public transport police, to help divert people from going into jail or having to be involuntarily committed to get them into services and supports prior to that police engagement. I believe currently there are not any existing partnerships between Marikey and those institutions. So at this point, we would encourage that interaction, that the police would bring someone into the emergency room, at which point they could be medically cleared and have a psych assessment, and then hopefully be engaged by the Marikey Wellness Recovery Team at discharge, so that they can help them in the community whenever they're able to be discharged into the community. But there is not a direct link at this time.
Okay, if you don't mind, if you could email me, because I would like to continue this conversation offline, to how, you know, we as a community can work together. We do have, what is it called? It's called police engagement, right? Police officer engagement, officer community engagement, police community engagement, in that context. And I just think that would be a good, you know, a good combination. So if you could provide me with some more information, and hopefully we can link up with the police department, someone in the police department, and just see how we can have that direct contact when they do, and you know, and run into those issues.
Absolutely.
Thank you. Hold on, Councilwoman Cabrera.
Yes, one last comment. Just to piggyback on what the chair said, our community engagement unit, which we expect during the budget hearings that we're going to see that expanded. Right now, the chief did put officers in certain communities, and they're the same officers. They know the people there. They're going to know who the players are. So it'll be great for them to know the resources that are available. And you have some excellent ones in your neighborhood now in that area. The point that I wanted to make, because I did hear you when you said that ongoing fundraising has to continue. Funding is still needed to grow this village. So if you could share with us how folks can get involved, how they can donate, whether it's private organizations, other nonprofits, us on city council, is there any funding the city is providing towards this project, and how we can maybe individually also help to fund this with our discretionary funds, if that's, you know, permissible, how we can help support the program. But most importantly, we want people to know how they too can support the program. Could you share that information?
Yes, so we do have a philanthropy team and our advocacy team that is working on that. So both for private, corporate, and governmental funding. So we'll be happy to share that information. Definitely appreciate your comment on that.
Thank you. Yeah. So, you know, the money's important, because these things that you're doing are great, but you got to fund them.
Yep.
They got to be funded.
Yep. And I just want to add to that about the police engagement. The health center is definitely geared to serve those patients that may have outbursts or have special needs. Our staff will all be trained to be able to deal with these issues that come in, and to make people feel comfortable to come in as well. That's one of the reasons that we'll have rooms that are sensory friendly for them, and just make sure that they're comfortable and they can get around and have access to the rooms as well.
Thank you so much. Are there any more questions? Again, thank you so much for coming, ladies. I truly appreciate your presentation. Akira, can we get a copy of the presentation?
It's on the website, and I'll have one for you.
Okay. Thank you. Okay.
Do you need our information?
Since they're, I'm sorry, what'd you say, Akira?
I think I have it.
You have it? Okay. Yep. I was just making sure she had our information for contact.
All right. If there are no more questions, I would take a motion to adjourn this meeting.
Motion, Madam
So
Chair.
move.
Second.
Second.
Thank you so much. Oh, wait a minute. All those in favor, I'm sorry, all those in favor say aye.
Aye.
Or
Aye.
Thank you. It is considered now adjourned. The meeting is considered adjourned. Thank you so much, everyone. I appreciate my colleagues as well. Thank you. You all have a good evening.
Have a good night.